My name is Michael Betel, and I'm the president and founder of the Fatty Liver Alliance. Today, I want to welcome two incredible guests and a brand new topic to discuss. How great would it be if we could identify patients who are most at risk for advanced liver disease much earlier than we could have in the past? Dr. Mark Swain, hepatologist and professor of medicine from the University of Calgary in Alberta, Canada, and Dr. Tim Jobson, gastroenterologist, medical director, and chief investigator for the Somerset Liver Improvement Project in the UK, are both with me today. Tim, what do you see as the biggest challenges we face identifying patients who are most at risk of advanced liver disease?
So, I mean, this is a major topic for chronic liver disease for everybody who's involved in this field. And the key challenge, obviously, is that these patients present late. They present with advanced disease. They present with cirrhosis, or very commonly in our practice with decompensated cirrhosis. So the disease is so advanced, there's very little that we can do. If they're not a transplant candidate, often this is a pre-terminal event, and very little that we can offer them in healthcare. So we need to identify these patients much, much earlier in their disease course, because there are treatments for pretty much every chronic liver disease out there. Whether that's lifestyle intervention, whether that's specific drugs, whatever it is, whether it's antivirals or anti-inflammatories, there are treatments available, and we need to identify people earlier. So I guess one of the questions is, why aren't we? We sort of know what to do. We know that patients with abnormal liver tests shouldn't be ignored, or people with lifestyle risk factors, particularly for fatty liver, or who have other medical conditions associated with fatty liver, like type 2 diabetes. These people need to be screened, if you like, but tested properly, and those tested acted on. So I guess where I was coming from with this work is, we keep seeing people in the clinic and we just look at their blood tests going back 10, 15 years, and it's all there. It's all there to see already. Where I live and where I work in the UK, we have a pretty stable rural population. We've got the same database of blood tests going back 15, 20 years for these patients, and we can just see, hang on, we should have known about this patient earlier. So that's the challenge that came out of the clinic room for us.
Okay, that's great. Thank you, Tim. And Mark, in Canada, what would you say? You agree that there's an issue in identifying that early identification?
I think it's the same problem around the world, really, uh, and this concept of seeing people that come to you and in Canada they're being referred to, and then you look back and you see these tests that are abnormal. It's obvious there was something going on in their liver for a long time. I think part of the problem too is as specialists, we're certainly in we're part of the long-term problem, in that is that individuals used to be referred to us. We didn't have a good, or we had no non-invasive tests of examining these people's livers. So we often would see these people, and if it turned out we ruled out the other cause of liver disease, which at least was a big step forward because we ruled those out. But if they were left with fatty liver disease, we often sent them back to the family doctor, recommending things like lifestyle, but actually often saying that this is a benign, felt to be a benign process, non-progressive. And so over the years, we've actually created an issue where there's a large belief that of the people that understand and know what fatty liver disease is, and at a primary care level, they often go, "Oh, that's okay. It's just benign. Don't worry." And we know now that's not the case for everyone, and so we need to have a structure in place that we can pull those people out that have a liver issue. Obviously, people with fatty liver disease have a metabolic issue broadly, but there's only a smaller subgroup that have significant liver issues, and that we need to be able to identify them and stream them into the right stream so that they can be managed from a liver point of view, as well as their other metabolic comorbidities.
Like thank you, Mark. And we recognize, the rate's 25%, is it 40%? I don't know, but there's obviously a lot of people who have fatty liver disease. There's pharmacological solutions that are on the horizon. They're coming, and waiting until the last second when they're actually approved and then worrying about the problem is probably not the best approach. So you're both right. We need to really, this is the right time for us to be doing this.
And we have, I mean, we don't have approved pharmaceuticals yet, but we actually, it's interesting. Certainly, I'd be interested to hear what's happening in the UK, but here in Canada, people are using more and more of things that they can access to help these patients, even if they're not diabetic. GLP-1 agonists are becoming things that are very commonly being used, even though they're not approved for weight loss in Canada. They are being used, and it's quite striking to see how that has changed in the last 6 months. Even it's really quite mind-boggling how primary care is starting to see that we need to do what we can do to help people. And one of the things we can do is some of these drugs that are available, certainly if people have the means or ability to access them, is that they are quite good at helping people lose weight, which is a big cornerstone of managing fatty liver disease.
Tim?
Yeah, absolutely. And I think maybe we're not quite there in terms of recognition and treatment in primary care. And I think absolutely what you're saying has played out. It's a benign condition, it's purely lifestyle. And interestingly, I'm now working in a centre where we do have bariatric surgery, which will have a huge impact on people with type 2 diabetes. But the rest just get a minute or two with a primary care physician who says, eat less, move more, and off you go. And I think people aren't taking it seriously, and that's why we're seeing this cumulative liver damage over many years with people where their condition has not been addressed at all.
And Tim, my sense is too that I hear primary care physicians are really busy with lots of different things, not only a lot of patients these days, but a lot of things on their plate. And so maybe the thing like what you're working on right now is a more effective way to identify patients that they don't have to actually go back and look for, right?
Yeah, absolutely. So I sit with a patient in the clinic and you'll see a string of abnormal tests going back 10 years. And the patients have asked me repeatedly, why wasn't this acted on back then, or that one, or that one? And of course, we know part of the answer is on any one day, it's not dangerous. It's not a condition that needs immediate and urgent treatment. And so it just gets left. And you're right, they go back to their physician a few months later, have another set of blood tests, and sure, the same thing's there. And the physician goes, well, it's stable, or they don't even look back. And so that's why you get this, when you look back, this real sequence of abnormalities that's never actually addressed.
Sorry, Mark, did you want to say something?
I think that's exact
Okay.
the issue over and over and over again, and that I think what Tim is doing, and I think what people are around the world are trying to do is how can we actually look at these people in a way that's removes out that human thing where they have to evaluate those tests, or provide them with a tool that allows them to very simply assess if these people have liver disease or not, and so that they can access care as opposed to just repeating the tests over. I mean, we also look back and you'll see the people may have fatty liver on ultrasound that dates back 15 years, and they're getting ultrasounds done every year, and sure enough, the fatty liver is still there. But there's nothing like it's not just a management issue with regards to the individual with fatty liver disease. It's also at the cost of the healthcare system is astronomical. Reading these tests over and over and over again, or doing them over and over again, without having any real plan in place to actually how you're going to act on them. So it's doing a test without acting, and so it's to facilitate the action. I think is really the key, is to get that switch to go on, whether that person then is referred or not, and based on objective evidence. I think.
Well, that's a big part of it, right? Because you can't, millions and millions and millions of people can't go to the specialist. So we're definitely going to have some kind of algorithm referral pattern of some kind. I wanted to talk, if I could, a little bit, if you can both comment on, like, so what? So people want to know, so I've had it, many people have had it for many years, and it's like, it hasn't really changed my life because I got other things to worry about, right? So what is the advantage of earlier identification for patients? Tim?
So yeah, so absolutely. I mean, I think our early experience with our project, where we've actually, and we're already calling patients in, so we're reversing the referral process. We're calling patients, we're kind of letting the primary care physician know that we've identified a patient. Unless they have any objections, they're going to come to us. So we're doing that already. And interestingly, I think those patients have a very different perspective on their condition. Firstly, the feedback we've got is incredibly positive. So patients are saying, yeah, I'm really glad you did this. But also, it's a kind of wake-up call to the patient, particularly when it comes to lifestyle and so on. So that approach of seeking out the right patients and engaging with them in that way, I think triggers a different response, rather than being told by your GP yet again, look, you just got to be more healthy. And certainly that's what we've observed.
And of course, the problem with being told you need to be more healthy is that we all know we need to be more healthy. There's very few people that get up in the morning, gosh, I'm as healthy as I could possibly be. And so
Yeah.
it becomes, when you get told it over and over again, and we all kind of recognize it in our mind, we have a filter for everything, and we just filter that out, and so it doesn't create any action, and unfortunately, it just becomes almost like a ritualistic thing within the family. Oh, you got to be healthier, and then of course what happens is that say as people are gaining weight, they start to get arthritis and issues with, so their mobility is affected, so it becomes a self-fulfilling prophecy that they really can't engage in physical activity like they used to or whatever, and it just gets worse and worse, and it becomes very, very challenging for them because that it's a negative reinforcer over and over and over again.